Tom Lonsdale here. We're going to show you some short video segments of Jiminy, a delightful black and white 10-month-old domestic short-haired male cat. A while ago though, Jiminy was not in such great shape. He had gingivostomatitis in a bad way. He went to, I think it was 3 general practitioner different vets. Each one had not much of an idea what to do. Finally, he was referred to a specialist small animal hospital, and they diagnosed him with gingivostomatitis. As I say, this is a rotten condition of the mouth affecting cats of all ages, and when they get it as juveniles, well, it can be pretty severe, as we'll see in some of these still shots. The specialists had advice for the owner, and it goes something like this. Treatment of this debilitating oral condition will typically involve either one or both of 2 options, depending on the extent of the disease: medical management using drugs to suppress the immune system and control the proliferation of bacteria in an affected animal's mouth, or surgical management, which is likely to entail removal of all of the cat's teeth. If you get rid of all of the teeth, says Dr. Rawlinson, you'll be getting rid of all associated bacteria. Once a cat gets over a full mouth extraction, which will take between 5 and 10 days, it can go on to thrive very well. About 60% of cats will need no further medical management and will have a high quality of life. It won't have a normal oral cavity, but it will have such minimal inflammation that it won't need medication. Okay, so that's the conventional view of the majority of vets. Now, why has the cat got bacteria on its teeth? Why does it need to get them cleaned away, or the cat's teeth removed in order to remove the bacteria? Well, of course, it's a very good question, and the answer is it doesn't. It should have been cleaning its teeth from 3 weeks of age, and in which case it wouldn't have had this indignant immune system overreacting against the bacteria on the teeth. So the conventional approach is to rip out the teeth and leave the cat to eat canned sludge for the rest of its days. Fortunately for Jiminy, we took a different route, and you'll see him ripping and tearing and enjoying his feasts of rabbit head and other succulent parts. We don't know ultimately how well Jiminy is going to fare, but we're hopeful that he's going to lead a full and happy life, gambling in the garden and ripping and tearing into his natural prey, just like all pussycats out there on this wonderful planet should be doing. Okay, so we've got some still images of Jiminy just prior to him undergoing his surgery. Have a look at these inflamed gums, fire engine red and absolutely inflamed. What's going on? Well, the body, Jiminy's body, is completely offended by the amount of plaque developing on his teeth. Incidentally, notice you can't see that plaque in these pictures, but the plaque's there all right. These are microscopic organisms that the body is trying to get rid of. And according to Sash and the experts, the way to get rid of these bacteria is to remove the teeth. Well, but anyway, that's an aside issue. The body in these particular photos is trying to do the job itself. You can see how the gums are growing over those molar teeth. Can you see that exuberant gum tissue trying its best, its damnedest, to get rid of the bacteria? Okay, so again, have a look at the profound inflammation around those first premolar teeth, little tiny teeth in a sea of inflammation. Also, the tiny molars behind the main molars, they similarly are completely overwhelmed by the inflammation. So our approach to all of this is, in fact, to remove those small teeth that otherwise can't be cleaned, that the inflammation of the gums can't be resolved. So we took those out. We then went on to curette, that is, scrape away that exuberant gum tissue. Get rid of that, expose the tooth, and clean it up, and then give it a chance to clean itself with the proper eating of the proper food in due course. Now, we didn't just do the surgery, we also at that stage introduced some drugs as well. A sort of belts and braces approach. Do more than one thing, give the patient the maximum chance of recovering. So much of our treatment depended on this stuff. One shot of long-acting corticosteroid called Depomedrol. When I say one shot, actually we infiltrated around the mouth and around the gums, half a cc. Put him on a course of doxycycline. Why? Well, that's pretty good against mouth organisms, but also it has anti-inflammatory properties too. Gets rid of the collagenases, or so we believe. So a course of that stuff was implemented. And then, because we were concerned that maybe, just maybe, there's some viruses involved, we gave a course of famiclovir. However, the main medicine, the most important aspect of all this, was nature's remedy. Jiminy was then put on a course of proper food and medicine. So that entailed whole chicken, legs, wings, quail bodies, and rabbits. And we'll come to see those in a moment. But for now, let's go and have a look at the mouth after it had had this treatment over a period of about a month. So here we are with some follow-up photos. Look at the improvement in this mouth. Isn't it terrific? Doesn't that gladden your heart? What can we see? Well, an absence of all that fire engine red stuff all round the mouth. Notice that a couple of premolars have been removed. Notice also that one of the incisors has been removed. And as a consequence, the gums were able to respond and heal themselves up. Bear in mind, of course, that these photos were taken in the conscious cat, and he wasn't altogether cooperative, so we don't have the best possible photos, but they're good enough to show that this cat is indeed in much, much better health. And that better health doesn't just relate to inflammation in the mouth, because of course the inflammation in the mouth was having a profound effect on the rest of the body, as was the junk food that the poor cat was forced to consume prior to us getting involved. All right, well, I think now's our opportunity to go off into the freezer room and see the chest freezers full of food and medicine for our carnivore companions. Let's go and have a look. Well, welcome to the Medicine Chest Emporium. Here we have the real medicine for our carnivore companions. For the larger carnivores, we have kangaroo pieces, and of course here the chicken frames. But for Jiminy, after his surgery, and it's very important to recognise that Jiminy helped himself. He was prepared to switch from the junk food diet over to a much more natural diet as ordained by nature. So chicken frames, little quail bodies, right? Little fat quail bodies. There's 2 in a pack there, and he would rip and tear into those. But more importantly, bunnies. How about that little beauty? And this was the key to saving Jiminy. Jiminy was heading for a horrible final outcome until he was reintroduced to what was preordained by nature. His birthright. He was supposed to be able to rip and tear his way through bunnies. Now this one's of course frozen and very stiff, but once it thaws out, then it's perfect carnivore food and medicine. The most gentle, most effective, safest, strongest medicine available for our domestic carnivores. So shortly we'll see some videos of Jiminy ripping and tearing, showing us how a natural born predator manages to cope with his food and medicine to the betterment of his teeth, gums, and the rest of his bodily good health. So here we are, Jiminy showing us how it really can be done. The ripping, the tearing, the chewing, the gnawing, really getting off on this. He's developing a bit of a chemical high here. The endorphins in his brain are circulating. The endorphins are then triggering the immune system. And at the same time, of course, he's cleaning his teeth and his gums and telling the stomach that something's on the way down. This is critically important for all carnivores. So it's the texture as much as the ingredients, the texture of the food and medicine that does such inestimable good for the carnivore. And Jiminy is showing us how. Isn't this terrific? So we started off seeing his fire engine red gums, and now we can see an exuberant little carnivore ripping and tearing into his real natural prey instead of the exuberant gum tissue trying to overcome the effects of the junk food that he'd been previously on. Keep in mind, of course, that this is not, and as I've said, not just about the ingredients, this is about the texture. And that's why all these junk raw concoctions that are now flooding the market are completely inappropriate. People get sucked into the belief that something that might be raw might be good. Alas, Jiminy, I think, demonstrates the error of that line of thinking. We've got to have the texture. All these carnivores should be ripping and tearing, maybe not at every meal, but most meals. Okay, so whole carcasses or whole large pieces of raw meaty bones. Occasional bits of liver and kidneys and tripe and so on might be appropriate. But for the most part, the prey of our carnivores, whether they be cats or canines, comprises animals with fur on, birds with feathers on, and fish with fins on. Fur, feathers and fins are really the hallmark of the proper texture of the food of the carnivores. All the best. To find these books and lots more information, visit rawmeatybones.com.